Well, thank you very much, Kathy, and I want to thank you and Tony Regine for this great opportunity, and also commend Rhode Island AARP for all the work you're doing to ensure that seniors and all Rhode Islanders are aware of some of the proposals that are pending before the Congress that could have immense consequences for health care, particularly health care for seniors. We're engaged in a debate about balance of the budget. I've been in that debate before in the 1990s under President Clinton, and we were able to balance the budget. In fact, when he left office in 2000, we were predicting, not just the Congress, but all of the agencies, the Congressional Budget Office, trillions of dollars of surpluses. Those surpluses were, in my view, squandered by many of the Bush policies. But going back to 1990, we were able to balance the budget without holding Medicare and Medicaid hostage and without threatening Social Security. And we can and we should be able to do it again. We have to recognize that we have to make sensible cuts, but we also have to recognize we have to continue to grow the economy because the more people who are working, the more robust both the Medicare funds are and the Social Security funds. So this is once again, a challenge, but it's a challenge I believe we can meet, and we will meet. But one thing we have to recognize is that the Republican proposals to transfer Medicare are something that will not lead to reform. It will lead really to the ending of the program as we know it. They're talking about shifting costs to seniors beginning dramatically in 2022. And an interesting point I think should be noted is if we're in an immediate budget crisis this year and their proposals don't kick in until 10 years from now, what's really afoot here is not about balancing the budget, it's about unbalancing Medicare and Medicaid, and I think that's wrong. We have to recognize that we have to make reforms in the program, maintain the program because it's been very effective over its history since 1965. But that's not what they're talking about. They're talking about shifting course. They're talking about giving seniors starting in 2022 $8,000 a year. Well, this year the average cost to Medicare recipients is $12,000. So how do you start in 2022 with a $4,000 deficit in your own personal accounts? And the other factor, frankly, is they're going to put it into the private insurance company realm. And some of us are old enough to recognize that the reason Medicare began in 1965 is that at some point private insurance companies will not insure a senior regardless of how much you want to pay. It's just not a good business proposition for them. And frankly, if we follow through in some of these Republican proposals, we'll be right back where we were in the early 60s, in the 50s and the 40s. And there, most senior health care was, staying in your child's home while you were cared for, while the little kids, I was one of them at the time, ran around. That's not cost effective, I don't think, to society, nor is it the best form of care. We've already taken some steps to improve the financial solvency of Medicare. We did it in the context of the health care reform bill that we just passed. There, we've provided free preventive care for seniors. We've also closed the donut hole so that seniors now can have better access to prescription drugs, which will help them be more independent, help them respond to their medical concerns. And we're going to do more. But those are reforms. Those aren't the abandonment of a program. Now, we also have to be concerned about Medicaid because many seniors rely upon that for their nursing home care. The plan is to block grant it, the Republican plan, and ultimately to make those block grants smaller and smaller and smaller. So once again, huge pressure, not just on seniors, but on their families. And frankly, if these plans go forward, if you're someone who's in their 40s, you've got to start thinking about how you save for your health care and also how you save to take care of your parents when they don't have the kind of care that Medicare provides today. And there's another important issue, and that important issue is Social Security. We've had periods before and certainly in 1980s on a bipartisan basis, have sat down, come together, and reformed Social Security so the solvency is increased. We have to do the same thing. But we can't hold it hostage to this current deficit debate. Social Security Trust Fund is independent in the sense that if the resources are not there to pay the full benefits, then the benefits are adjusted. It does not require the federal government to step in and make up the difference. But we have to have this Social Security program in place with full benefits. That'll require some changes. And it's particularly important today because, frankly, again, going back not too long ago, certainly when I was younger, there are a lot more defined benefit plans that business offered. Those plans are rapidly going away as they go to IRAs or 401ks. We've got to have a plan like Social Security, a defined benefit. You know what you're going to get each month, and you be confident you'll get it. So there are lots of issues here on the table to talk about, and it's something I think that's important. One, I hope and I expect we will, through hard negotiations, begin to reduce our deficit as we did in '90, balance our budget, move forward. We can do that without undermining Medicare and Social Security. And thank you, Kathy, again, and Tony, for this chance to talk with you and to your colleagues.